everyone, this is Dr. Gaines at the Melville School District with our little data update for November 20th. Before we get into the data, I do want to hit on a few things. One is that we're not going to do a data update next week over Thanksgiving, so I hope everyone has an enjoyable Thanksgiving, and we'll talk about that a little bit later. Also, it's doubtful that there will be a video update the week after, so it's probably going to be December 10th or 11th before we do another one of these videos. We also want to take a little bit of time just to remind folks of kind of the basics of the coronavirus that we've been dealing with. One of those is that symptoms appear after exposure, anywhere from 2 to 14 days. So what that means is at the infectious period a person has starts 2 days prior to symptoms. So that asymptomatic spread is something that we have to be mindful of and watch out for. We also know that masks and social distancing and washing your hands are all effective mitigation strategies to help reduce the spread of the virus. In the media, we've seen recent reports of studies coming out of St. Louis University around the impact of masks on spread, and that masks do make a difference. We also know from data from districts all around and our medical professionals in the area that the transmission in schools is relatively low. What we are seeing is low because of the mitigation strategies that schools have in place and that schools have instituted. However, transmission out in the community is much higher because there's no consistent use of the mitigation strategies. So where we find ourselves today is that we have very incongruent guidance at different levels. So we have CDC guidance, which is incongruent with state guidance, which is incongruent with county guidance, but the county guidance is a little bit more congruent with the CDC guidance. So we're continuing to follow the guidance of our most local governing piece, and that is county health. Now, I talked about mitigation strategies, and if we go back to the spring, one of the things that we were hearing a lot was to think about the mitigation strategies like Swiss cheese, okay? So one piece of Swiss cheese has got a lot of holes in it, right? But if you begin to layer those pieces of Swiss cheese, right? So we put another piece on and we can see a little bit less, and less is going to pass through those holes. And we keep adding cheese, and we just, as we add those layers, we reduce those holes that are in the cheese and what we can go through. So if we add enough layers of cheese, hopefully we get to a point where we can't see through the cheese. So that's what we need to think about in terms of mitigation strategies. If you want to think about mitigation strategies as Swiss cheese, and the more layers that you have, then the more you reduce the transmission of the virus. So let's go into the data now. So I'm going to start with kind of our regional data and take a look at regional transmission rate. No surprise that with what we've seen in the media around rising cases, we're seeing a rising transmission rate. So if we go back a few weeks, we had been hovering around 1, now we're up around 1.26. And what that means is every person who has the virus is likely to spread it to 1.26 persons, although I'm not really sure what a 0.26 of a person is, but the main idea is that you're spreading it to more than one. If we look at county positivity rate, what we've seen there is we had that little bump up in early October, and then Halloween, it just really took off. The virus really took off across the region, across the state, and really across the country. If we look at the cases per 100,000 in our 3 zip codes, we kind of see the same kind of increase around Halloween. So if we look at our data from the community standpoint, what we see is that the virus is spreading within the community. And in many respects, it's the highest that it's ever been. And what we're finding is that the cases among our parents and our guardians are resulting in students failing our screening questions and then not being able to come to school. We're seeing more and more of that as the virus spreads within our adult population in the district or in the community. So let's look at our internal data. So like I've said before, every Monday we post on our website information from the prior week. So this is what we posted Monday for that November 9 through November 15 time period. And you can see that we had over 500 students that were asked to be off campus. The week before it was a little over 300, so we have seen an increase there. On the staff side, we did see a decrease in the number of staff who were asked to be off campus, but we've kind of got ourselves in that position where we had over 100 asked to be off campus at one point, and that's what kind of helped lead to the decision last week that we needed to shut down the high schools because of our workforce challenges that we were having. If we look at each level and student cases, you can see week over week what's been going on. Elementary was fairly stable, as was high school in terms of the number of cases reported, but we did see a pretty decent bump up at the middle school level. If we look overall and what we've had on campus, you can see the number of students asked to be off campus has been steadily rising over the last few weeks, and last week that ended up being about 6.5%. And we know that we have overlap with the prior week, so it ends up being a little bit above that. If we look at the state level data for the district, so this encompasses kids who may not necessarily be in our schools, we can see that the number of cases in the 14 days prior to November 11th had gone up by about 30 from the number of cases in 14 days prior to November 4th. Hopefully we'll see another one of these reports come out today. You can see from the dates, the last couple of weeks it's been on Friday, but it's been really no consistent time frame in which those reports come out. So what we're seeing with our internal data is that the number of students and staff that have to remain off campus because of an exposure, it's about a split on whether or not that exposure was here on campus or whether that exposure was off campus. So we're seeing a little bit of split there, but we know that those exposures, as well as students and staff members failing the screening questions, has made it a challenge. And with staff exposures having to remain off campus and staff failing the screening questions, that's made it a real challenge to cover classrooms. Not just here in Melville, but we've seen that happening across Missouri. In some cases, that's been concentrated within bus driver populations in some districts, and they've struggled to have school because they don't have enough drivers to get kids to school. We also know we've been able to look at cumulatively, we've had about a little over 1,500 students asked to stay off campus, and we've been able to trace that about 4 of those students, or 0.25%, ended up testing positive. That's why we say low transmission here at school. We do know that because we closed high school, we have been able to shift personnel around, and that's relieved some of those workforce shortage issues. So looking forward, we're going to keep elementary and middle school in our blended model. High school will remain in our connected model. However, we're going to make a slight tweak at Thanksgiving. Wednesday through Sunday, that's Thanksgiving break. The week after Thanksgiving, we're going to take a little bit of pause and go 3 days of Connected for K-12 as a mitigation strategy. One of the things that we've learned as the virus has gone on is that although symptoms appear 2 to 14 days after exposure, most of those symptoms, and most people experience symptoms within 5 to 7 days. So by taking a few days of pause after the holiday, we believe that more people will be able to show symptoms, and we'll end up with less folks on campus who may be asymptomatic carriers. So the Monday, Tuesday, Wednesday after Thanksgiving will all be in the connected model, and then we'll return K-8 to the blended model on Thursday, December 3rd. And we're hoping this mitigation strategy that's added, which our Return to School Committee did recommend that we consider doing this, we hope that will help reduce spread and reduce on-campus exposures in that week after Thanksgiving. So again, as we've kind of said every week, please be sure to wear your mask, avoid large gatherings, social distance, all of those good things. But if nothing else, please think back to the Swiss cheese as you think about Thanksgiving. And the more layers of Swiss cheese, the more we reduce transmission. So I hope everyone has a great Thanksgiving holiday. Please be safe. So we look forward to seeing everybody when we return after the Thanksgiving holiday.